to the Idea Exchange podcast. In today's episode, we are talking more about cerebral malaria. I'm your host, Wes Piri, and our guest is
Vincent Chilemba.
welcome.
Thank you.
What is cerebral malaria?
Cerebral malaria is a complication of malaria caused by Plasmodium falciparum that is associated with a cerebral manifestation. So it typically presents with reduced consciousness or coma, seizures, and a fever. And malaria in general is caused by different Plasmodium species, but for cerebral malaria, it's just falciparum. And so not always when someone has malaria due to falciparum that they develop cerebral malaria.
How common is cerebral malaria and which population are most affected?
There hasn't been any recent studies quantifying the cases of cerebral malaria, but a study done in 1999 showed that for every 100 children, that's children under 5 admitted in the hospital, 3 of them would be admitted because of cerebral malaria. And it's common among children that's under 5 and some immunosuppressed individuals.
What are the primary causes of cerebral malaria?
So the primary cause of cerebral malaria is Plasmodium falciparum, and this is for cerebral malaria specifically. It's when the Plasmodium is deposited, or it's yeah, I think most accurately deposited in the brain tissue. So during the course of the infection, most of the times when there is so many parasites in the body, they might end up being deposited in the brain, causing cerebral malaria.
How does cerebral malaria impact the quality of life and overall health?
So cerebral malaria affects the brain and can affect brain function. For the most part, the patients can be in a coma. So quality of life for someone in a coma is almost non-existent. And when they're not in a coma, they might have other complications like seizures and maybe reduced consciousness, reduced focus, and other complications associated with the brain, and this does reduce the quality of life significantly. On overall health, malaria in general, not just cerebral malaria, has a toll on overall health. It affects red blood cells and uh, can lead to uh, breakdown of the red blood cells beyond the normal rate, and can cause other complications like anemia, can cause fevers, can cause severe headaches, and other associated symptoms.
What are the key differences between cerebral malaria and other types of malaria?
Uh, in general, the other types of malaria they can be associated with the other uh, Plasmodium species, including falciparum. But for cerebral malaria, it's just falciparum. And cerebral malaria involves the brain. It's not just malaria. It's like beyond just malaria. It's when you have malaria and it's complicated with the brain. Whereas general malaria is just in the brain cells. And also, most cases that develop cerebral malaria, they end up dying. Like not most, like more cases who with cerebral malaria, they end up dying than cases with just mere malaria. So cerebral malaria has a higher mortality rate.
What are the most significant risk factors for developing cerebral malaria?
So the most significant risk factor for developing cerebral malaria would be children under the age of 5, because most cases are seen in these group, or impaired immunity. People who have reduced immunity, maybe because of treatment or maybe other disease conditions like HIV. lack of prior exposure to malaria, like lack of immunity specific to malaria. So for someone who has never been exposed to malaria, maybe someone just coming into a malaria endemic legion from somewhere else, they might be exposed to, they might be predisposed to developing cerebral malaria in case they catch the parasite. Uh, Also, legions where there is higher malaria transmission, you tend to see more cases of cerebral malaria. When there is delayed treatment, when malaria, the general malaria is not being treated, might complicate to cerebral malaria. Or when there is a higher parasite load. So this cannot be can be due to delayed treatment, or maybe repetitive infections.
How does Plasmodium falciparum infection lead to cerebral malaria?
So when the parasite, the Plasmodium, is in the blood, it primarily affects red blood cells, and when there is a higher parasite load, when there is so many parasites in the system, they tend to attach to the vessels or the brain, so the blood vessels of the brain. So they might cause the cells to attach to the vessels of the brain, or they might exit the cells, the red blood cells, and directly attach to the vessels of the brain, and this presents as cerebral malaria.
What role do environment factors play in cerebral malaria risk?
So environmental factors can can be associated with a higher or a lower spread of malaria. In some environments, there are even no local spread of malaria. Like malaria doesn't exist, we can say, in those environments because there are no mosquitoes that can transmit specific mosquitoes that can transmit malaria. So environments that have mosquitoes that can transmit malaria will be the largest environmental factor that can contribute to cerebral malaria risk. And being living close to stagnant water bodies, this is a breeding ground for mosquitoes. Can also increase the risk of malaria and cerebral malaria. Uh, Also, lack of methods to reduce mosquito bites, like maybe treated mosquito nets, repellent, or other techniques to reduce the mosquito bites or to reduce the population of mosquitoes in that particular environment.
How do individual characteristics affect cerebral malaria susceptibility?
All right, so some individual factors can affect cerebral malaria susceptibility, like being under five. Individuals who are under five tend to develop cerebral malaria often than older individuals. Now, reduced immunity associated with pregnancy or other disease conditions, and also maybe delayed treatment in pregnant women due to uh, masking of the signs and symptoms of malaria to other signs and symptoms that are associated with pregnancy. And lack of prior exposure, individuals who have not had any prior malaria infection are also more at risk of developing cerebral malaria in case they catch malaria.
What are the early warning signs of cerebral malaria?
So the earliest signs will be signs of malaria. That's before it has complicated to cerebral malaria. So this includes cyclic fevers. So these are fevers that uh, come and go. Like at some point you have a fever, on the same day, another point you do not have any fever. Headaches and fatigue. And in an individual who has been diagnosed with malaria already, the most early warning sign would be reduced consciousness or maybe coma.
How is cerebral malaria diagnosed and what tests are used?
So to make a diagnosis for cerebral malaria, the individual should have a positive malaria test, and the parasite should be specified to be falciparum. They should have reduced consciousness, or they should be in a coma with a Brandt coma score of less than 2. Recently, they have also added retinopathy, so they should also have retinopathy. So this is seen by observing the back of their eyes. So is a typical presentation of people on among individuals with cerebral malaria. So all these need to come out positive to specify the individual to be with cerebral malaria. And also other causes of comas should be eliminated. They should be considered and eliminated to make a correct diagnosis.
What are the key clinical features of cerebral malaria?
A key clinical feature of cerebral malaria is a coma or reduced consciousness. So this coma or reduce of consciousness should not be associated with any other disease process that can cause them. Another classical presentation that has been recently explored is retinopathy. So uh, this is uh, this affects the back of the eyes.
What are the common misdiagnoses of cerebral malaria?
Common misdiagnosis of cerebral malaria usually happen when someone comes with a coma or any cerebral impairment, whilst they have uh, asymptomatic malaria, or whilst they had undiscovered malaria. So the causes of the coma might be a trauma with cerebral bleeding, or meningitis, or other uh, uh, central nervous system pathologies.
What are the most effective treatments for cerebral malaria?
So in our setting, most of the cases of cerebral malaria are treated with artesunate, and there's also some supportive care interventions to relieve symptoms and uh, to increase or to improve general health.
How does supportive care impact outcomes?
So supportive care can be used to stabilize the patient, can be used to prevent further complications and damage. They can also improve overall health. So on supportive care, someone can be put on a respirator to increase to increase the efficiency of the lungs, or in gaseous exchange. So this can help to help manage the patient better and help to to improve the overall health of the patient.
How do you manage cerebral malaria in resource limited settings?
So in a resource limited setting, like maybe a community hospital or a smaller clinic, uh, when they come across a cerebral malaria case or a suspected cerebral malaria case, they should test for malaria. In most clinics, almost all the clinics in Malawi, the malaria test, the rapid malaria tests are readily available. And when the test comes out positive, they should initiate malaria treatment, and they should leave the patient to a larger facility which is well staffed or might have better resources to continue the treatment.
What are the most effective strategies for preventing cerebral malaria?
So the strategies for preventing cerebral malaria would be the same as preventing malaria in general. So these include mosquito nets, mosquito repellents, draining swamps or draining stagnant water, change settlements to areas that are not prone to malaria attacks. And recently, they have introduced malaria vaccines.
How does vector control impact malaria transmission?
So malaria is almost always transmitted by mosquitoes. So controlling mosquitoes is also controlling malaria transmission. So when you control uh, mosquitoes, maybe preventing mosquito bites or reducing mosquito population, you can directly prevent malaria transmission and directly prevent cerebral malaria.
What role do vaccines play in preventing cerebral malaria?
So vaccines reduce the risk of getting malaria, especially in a population where most people have been vaccinated, and can also reduce the chances of the complications. So when someone who has been vaccinated against malaria gets malaria, they tend to handle it better than someone who has never been vaccinated. So the malaria in this kind of an individual uh, tends to be less complicated and is easier to treat.
How can individuals protect themselves from mosquito bites?
So to protect oneself from mosquito bites, they can get mosquito nets. So they should be treated mosquito nets. They can use repellent. So this can be sprays, lotion, or maybe some plants that can repel mosquitoes and other bugs. Now they should drain swamps, which can harbor mosquitoes that spread malaria. They can also introduce natural predators that eat mosquitoes or reduce population of mosquitoes like bats.
What are the challenges in controlling malaria in endemic regions?
So endemic regions are regions where they have where malaria cases are common, and they face challenges in controlling malaria cases, maybe because of overwhelmed facilities, or they also face challenges when trying to prevent the spread of malaria. This can be challenges in adoption of preventive measures, so as most people might be skeptical with the prevention measures that are being suggested, and they tend to have low compliance to the measures. Some areas also have alternative uses of mosquito nets. So they might have access to mosquito nets, they might uh, be given mosquito nets, but they end up using them in different ways or inappropriately. They might use them to fence gardens, they might use them for fishing and other alternative uses, and not necessarily being used to prevent malaria.
What are the potential complications of untreated cerebral malaria?
Cerebral malaria is already a complicated form of malaria, so it's a serious issue on its own. So when it gets even more complicated, is it will definitely kill the patient. So a complication will be death in this case, or there might be permanent damage to the brain tissue.
How do you manage cerebral malaria emergencies?
So cerebral malaria emergencies might come in a coma state. So for this patient, they will have to be intubated or and put on a respirator for respiratory support. They will need to be monitored and be attended to in case of any destabilization. And sometimes they might convulse or they might go into seizures. And for these particular individuals, anticonvulsants might be administered to prevent the seizures and the convulsions.
How do you prioritize emerging cerebral malaria cases?
So for the most part, we have a separate clinic to handle cerebral malaria cases in a particular facility. So, for example, at Queens, you have the emergency department for general emergencies, and from there, when someone has been diagnosed with cerebral malaria, would be taken straight to a cerebral malaria clinic. And under these clinics, you have more advanced care, more specialized care, and all the patients in this clinic are prioritized.
What ongoing research or studies are exploring cerebral malaria causes and treatments?
Most of the ongoing research not really looking at causes of cerebral malaria or treatment. I think we have reached a point where we are comfortable about the causes. So most research studies done right now are focusing on vaccination and better diagnostic tools. For example, here it was here in Malawi where the research that showed about retinopathy was recently published, linking retinopathy to a diagnosis of cerebral malaria.
How can healthcare providers stay updated on the latest cerebral malaria guidelines?
So they can be directly involved in researching and forming these particular guidelines so that they should be always updated. They can also be uh, going through latest research papers, and they can also be involved in conducting research in the field of cerebral malaria. They should also always go through the standard guidelines, the Malawi's general care standard guidelines, to stay updated with the maybe amendments to the guidelines to manage cerebral malaria.
How do you communicate with patients and families about cerebral malaria?
So to communicate with the patient or parents with a patient with cerebral malaria, you you must first reach a mutual understanding. You must be both on the same level on understanding of cerebral malaria, so that whatever you say they should be understood. You must get them in the management and alternative management, and you must give them advice on how to manage the patient better, on how to take care of the patient better.
Advice would you give to healthcare providers treating cerebral malaria patients?
So I would advise healthy care providers handling cerebral malaria cases to stay up to date, to seek research or recent research being done in the field, to seek even for progress progress being done in the same field under maybe other research bodies and under other facilities outside the country. They should also be directly involved in the research. They themselves should be taking part in the research, so that they should direct the research to a point where it is more clinically significant, and it's more relevant to take care of the malaria cases and the cerebral malaria cases.
Alright, thanks for your time.
Thank you.